Can telemedicine close the gap between regions and the center? And whether telemedicine is efficient when it comes to adverse medical situations? How does the digitalization can influence professionally the doctors? How the conditions should be organized to make high quality professionals to move from the center to the regions? This will be the topic of our current discussion. And the moderator will be Oleg Teplov, the Director General of Web Ventures. Oleg, the floor is yours. Ladies and gentlemen, dear friends, dear participants to the forum, I'm very happy to welcome you at this very nice event, Startup Village. And from the Moon Studio, we'll be today broadcasting and discussing the medicine and the technologies that are around us on a daily basis, and that also allow us to be healthy and quite energetic on a daily basis. Well, Russia is a large country with a huge territory and very difficult or different economic conditions. And Moscow and Saint Petersburg, of course, are those places that already have the high-tech medicine established. In some of the aspects, it can also be called a breakthrough medicine. It's enough just to mention that our country was one of the first one or the first one to register the vaccine against the coronavirus, the COVID-19, and it also has been registered in many countries across the whole world. And well, we have a lot of medical centers in operation here in Moscow, and their level of competence can be quite compared to some medical centers in Europe and in other places. And well, of course, the capital and the market in Moscow is quite an attractive one when it comes to investing in medtech segment. But against this backdrop, the regions of this country, especially quite remote ones, are lagging behind quite a lot as regards their development. And the market of private medicine in the remote regions lags quite a lot, and we experience a lack and a shortage of medical personnel. And the new efficient practices are coming to the regions very slowly. And even if they are integrated and implemented, but still a large amount of if the large amount of the population cannot pay for these kinds of services. But there are the new technologies in place, such as telemedicine, for example. Today, we see the market of it about 40 billion of USD, and in Russia, this accounts for about 1 to 1.5 billion of USD. And according to our forecasts, and it's confirmed by the statistics, we plan that by 2025, the market will increase in the amounts of 116% per year. And one of the initiatives that our company, Web Ventures, is doing is the initiative, it's called in Russian Dr. Radom, or the doctor is nearby, or RD group. And we also included telemedicine in the number of medical services that are provided proceeding from our mandatory insurance. And now a lot of people can access these services. And we will talk about it in detail with the guest speakers today. And I'm very happy to welcome them here. Today we have Sergey Sidorov from Medscan Group. We also have Olga Vasilyev from ECT Clinic Scandinavia. We online have joining the medical director of GSM Clinics and Hospital, Badma Bashenkaev. And we have Leonid Melamed, a representative and co-founder of the company DR Holding. And we also have Artur Isaev, the Genetico General Director. Good afternoon, everybody. I'm very happy to welcome everybody here. Well, today I'd like to talk about the value of telemedicine against the backdrop of the whole medical market. And also I would like to talk about medtech as a new segment, also to talk about preventive medicine. Because within your work and our work, we have a partnership with the National Technological Initiative, so to say, and they have a very nice project. It's called Health Net. There, young entrepreneurs and innovators present their solutions, also within the new non-invasive methods to control and monitor blood pressure, and some other methodologies are used there as well. But those are pilots, and they're still to be added to our life and to the just daily medical practices. And so, Sergey, perhaps my first question will go to you to follow on the topic of the development of specialized medical services. I'd like to ask you, what are the medtech sectors that will be developing in Russia the most dynamically in the near future? Perhaps you can see some trends, and you can advise not only to the professionals of the medical market, but also to the financial partners, perhaps to pay their attention to that and maybe invest in these technologies. Yes, indeed, I'll be very happy to share my views. Personally, I started to work on that actively 1 year ago. So we have a Hadassah clinic just close to this location. And of course, Israel is one of the largest hubs when it comes to medtech. Well, I can start from the far away, so to say. I believe that we all understand, or it would be very nice to understand, especially for potential developers, on how the big financial investors are thinking now. Well, we are at the eve of the global digitalization. And of course, it will happen. Actually, we do see it happening, and it has already appeared in the banking sector. Do you remember what the banks looked like before 2005? Large banks with a lot of branches, with large personnel, etc. But then came the Tinkoff without any branch at all. Well, just think about when was the last time they went to a bank. Perhaps you just got some cash from ATM, but that's probably it. I'm sure that you went to the bank for quite a long time. And so we will see the same kind of a disruption happening in the medical sector as well. I am sure that from 3 to 5 years, all our data will be stored in our smartphones. If we take a look at the clinics as they work now, well, I believe that the Russian medical sector is lagging behind around 20 years as compared to the other medical sectors in other countries. And, well, we see, for example, that when it comes to the finance sector in Russia, we are actually quite ahead of the time. We didn't have any infrastructure in the past, and we just skipped the phase 1 and 2, and we got to the phase 3 in our financial development. And I'm sure that the same will happen in the medical sector. If we talk about the pains of any medical center, I believe that Olga will agree with me. The main pain point is the medical information systems. I'm very sorry, those who develop them, but still, this is true. And the second thing that I would like to mention, and that is also a pain point, is the routing of the patients. If a customer or a patient comes to the clinic next to his or her home, then he or she will go through multiple different points of contact. And it can't be addressed now efficiently in our medical sector. We motivate doctors, we find them, but I believe that it should be solved with the help of the IT. I believe that it's what needed right now. If we talk about more long-term perspective, then I personally believe, and my company believes, that telemedicine as it is just a small tip of a big iceberg. And, well, wearable devices should be added to all that. And they could be quite different. At Taitakir, also, we try to bring it here from Israel. It's a breakthrough product in Israel. The devices are very very different, and there are some just genius ideas, some others that do not work that well. But we just need to understand, and we see and we hear it from all the consultants. They mentioned home care trend, when you can do a lot without visiting a hospital or a clinic. Not all of the things and procedures, but some of them. And it can start with the patient monitoring, then proceed to the telemedicine. And of course, this is a huge story. And this second area of development is everything that is connected to AI and IoT. But I think that I'll mention it a bit later. Yes, indeed. Thanks a lot for this very topical issue that you mentioned, indeed. Right now, if we just look at startup village, just walk around this territory in Skolkovo, and we will see that people have watches and they check their blood pressure, their pulse. Some of the people present here doing some sports, and this is all included in the personalized medicine customer journey. It is connected to the AI, to the preventive analytics that is based on the statistical data of patients. Everything leads us to what you've been just talking about. And I'm very happy that you've mentioned all that. Why? Because I believe that the approach that you've just described is the movement towards placing the patient or human being in the center of this whole process. So this is customer centricity, so to say. And this is just a direct response that we see also coming from our government. Our government is also focusing on customer centricity a lot, and we do the same in the field of medicine. And of course, private medicine plays quite a big role in here. You've already mentioned, and I believe that the colleagues could support your words here, and I'd like to draw some bridge to Olga Vasilyeva, the General Director of Scandinavia Clinics. So, Olga, could you please tell us, where are the points of growth for private medicine in Russia? Whether it's about the mandatory insurance services or perhaps about some provision of customers focused service through M&As and some comprehensive support centers. For example, as Sergey has mentioned, is this about building the proper customer journey, if we use the terms of fintech and retail? Well, thank you for the question. I do believe that the private sector should also be present in the public sector, because if we say that we are efficient, if we are doing science, we work with very difficult cases, then of course you need to be within the contour, within the framework of the mandatory medical insurance. Because if we just work with only those patients who can pay for their treatment, then we narrow our target group quite a lot, and we will not go beyond Moscow at all. And so private clinics are very interested in working with the system of mandatory health insurance. And I believe that the public sector should also be interested in that. The competition is good. In the past, of course, everybody wanted to keep their budgets, and the government sector, the public sector was quite restrained from spending their budget. But I believe that in 3 or 5 years, it will change, and the private sector will have to agree on how to cooperate with the public sector. Indeed, there are some very nice private clinics. We can be competing when it comes to the quality of our support and aid, as well as the quantity. And this is my call upon the government to also take part in that. And the second area, which is important, is the consolidation. One needs to be bigger. I believe that in retail or in banking, it's much more clear why one needs to be quite large and big. But here, when I talk about consolidation, I think that it's more about best practices, building some corporate culture from the inside that will require some very responsible approach and money, etc. And also what I believe in additionally is the brand of an employer for medical staff. Well, in some niches, we already compete for medical staff a lot. I will not mention the particular posts and vacancies, but sometimes we just search for specialists and professionals in different regions to bring them to Saint Petersburg, for example. And, well, of course, we would like to compete for the medical professionals, not only in terms of money and their salaries, but also we would like to provide them with the opportunities to add to the research and science, to play will be much more efficient with that. And the last thing that I wanted to mention, well, we see that all private clinics are still very small for being a quality brand. Here, I mean not only customer experience, because we currently all invest in the mobile applications, the friendliness of our staff, the good customer experience. And Sergey mentioned that we are lagging behind like 20 years because a lot of other industries already have learned how to do that. And the medicine is just learning how to be friendly with patients. Some clinics are already good at that, but not all of them. So we will be competing for the good outcomes, for our good treatment. We also will talk about how we can discuss our mistakes and errors, how we build this customer journey. Do we provide services, just services, or are we providing some long-term results? It will not come from the public sector. It will not come from small private players. No, it's not possible. And I do believe and I hope that when the players in the market become bigger, that's when we can address all these challenges. Thanks a lot. Well, what you've just mentioned and what you've just offered, this is the good process building when it comes to the doctor's work. You've already touched upon the IT systems or the medical systems. Whether the standardization or training on how to work with this big data, whether it can really help us to make this quantum leap when it comes to the quality of the services, because 2020 and the pandemic made something or did something very unique, because it all made our planet to digitalize as fast as possible. And it concerned even those industries where it seemed that there was no opportunity to do that, at least for the upcoming 5 years. Well, I became that medical systems, IT systems, it's the number one challenge indeed. What I cry about on a daily basis, well, for example, we have Mediology, and I'm sorry, dear shareholders of Mediology and developers of that, but I'm not satisfied with it at all. So it's good if we have a system that is not just for a doctor to write in some medical data, but the system that will enable doctors to feel better. Because today in Russia there is no such a system. If there is any, let's talk about it, but we monitor the situation in the market. Well, if there is a system that will help doctors to analyze the patients and to issue some recommendations or just notifications or reminders. For example, if a patient comes to a GP, then the system can advise or recommend the GP on when to do the checkup. The system could do that. For example, I'm Olga, 36 years old, and the system tells the doctor, well, you haven't been there, you haven't checked that particular function of your body. And the system can help with that. And this is the preventive medicine. We can use different examples. And here, we are calling it not the routing of a patient, but the algorithms. So this is like either comply or explain. So whether you have to comply with the standards or you should explain why you're not complying with them, right? So currently, the medical system of ours is just a chaos and it's just some bunch of text. I mean, the systems. So the doctors are having troubles with understanding all that, indeed. Right now, it looks like the mission is impossible. Indeed, thanks a lot. This is a very good statement for venture and finance investments. Well, invest in the IT platforms to make the lives of not only patients but doctors more efficient, better, and focus on the customer or on the patient. And to follow on the topic of digital systems, those systems that help both patients and doctors. We've already mentioned telemedicine, and now I'd like to address Leonid Melamed. Leonid, we've already started to discuss the telemedicine prospects, and well, let's talk about the costs. Let's talk about how telemedical services can help and be integrated into our daily lives. So my first question to you is, do you believe that, well, taking into account the pandemic experience and the development of telemedicine, do you believe that the telemedicine has been integrated into our healthcare system quite a lot? Because we do see that there are some very nice and promising trends out there. And so, what is the status of the telemedical services in Russia right now? Oleg, thank you very much. Very sorry for being late a bit. Good afternoon, dear colleagues. Good afternoon, dear viewers, dear audience that is following our dialogue. Indeed, telemedicine is a very promising technology. It is a very promising way to provide medical assistance. And as we continue to repeat, this is just an entry group into a large monument or a large building of the digital healthcare. And the contemporary medical IT systems, they are some elements of this building. And we do have some blocks already built both abroad and in Russia. One needs to say that, to my surprise, the year of the pandemic didn't result in a huge growth of the market of telemedical services in Russia, both paid and non-paid. And the picture is quite different if we take a look at other countries, the European countries, the Americas, Japan, India, etc. Last year, they demonstrated the growth in the number of users. In China, well, now we are more focused on East rather than the West. Well, we had the growth of 900%, and before that, the growth was 800% in Asia. Well, and in the US, they conduct 1 million of telemedical consultations per day. In Russia, the figures are drastically different. They cannot be compared at all. I believe that if we could say that there are 5,000 telemedical consultations in Russia per day, well, this would be quite a realistic or optimistic assessment. And at the same time, the companies that are ready to provide and offer these kind of services, here I mean the digital tools that they have in place, such as applications, platforms that are connected or not connected to some medical IT systems of the clinics, also to the payment systems. Well, we have a bunch of companies that could do that. And when it comes to the companies that stand ready to treat with the remote methods, the companies in the clinics that have trained their personnel and and which are ready to do all that, there are a couple of these companies. So actually, this is one group of companies, and let's call them. Let's say that we have about from 8 to 10 companies, enterprises, medical enterprises that are quite ready and prepared for all this. They do understand what is going on in Russia and abroad. They are prepared from the point of their technical capabilities and other ones. But the regulation system or regulatory system in Russia is so unfriendly towards the connection between a patient and a doctor that it results in such a gap between us, I mean Russia, and other countries within the framework of telemedicine. Well, I've been doing healthcare for quite a long time, and at the beginning of 90s of the previous century, we had the same gap when it came to the access to the ultrasound. Because, well, there were some countries with whom we have friendly relations or maybe not so friendly. In other countries, well, there wasn't just daily access to ultrasound, so anybody could go and get the ultrasound check. But here in Russia, 20 years ago, people were waiting for this for months. And those citizens of ours that are over 40, they do remember that they faced these problems. And today, we have the same problem or the same gap when it comes to remote medicine or telemedical consultations. Will it change? Yes, of course it will. What we require? What do we require for that? Well, first, the regulators' approach, the change of it when it comes to the sick leave and the medical assistance, primary one, when it comes to diagnostics. And secondly, what we need is some solution or some decision that these services, telemedical services, should be available free of charge for everybody in Russia within the mandatory medical insurance system. Why? Because these services are very convenient. Well, we've had the State Council gathered on the topic of medical assistance. It was headed by the President of Russia. Here, the main task is to just close the gap between a patient and a doctor, to have a seamless contact, convenient contact, and when the patient needs it. Can it be done through telemedical services? Well, I think you'd agree that it's evident that it is possible. And I believe that when we talk about some young people or elderly people that have the access to digital services, we've already tried all this. We've known that these services are quite convenient and friendly, and we'll continue to use them. So here, we need to expand the availability of these telemedical services. And it should happen not in 2025 or 2028. No, it should happen in 2021. And the readiness is there. I mean, there are both public enterprises and private enterprises, those that are financed from the public sector as well as by the strategic investors. So it's ready, and let's just make it happen. Okay, thanks a lot. We started our dialogue with saying that the accessibility of telemedical services with the participation of best specialists 24 hours, 7 days per week for all the citizens of this country is one of the ways how to make our medical sector and our state more customer focused. And these are the tasks that have been set out for us by the president. And I believe that jointly with our partners from the federal authorities and executive bodies, jointly we will come to some common denominator and we'll be able to make these quantum leap not in 5 years but much earlier, perhaps during summer of 2021. Well, it's good if the summer will be not very cold, but a cool one and a nice one. Well, and not everybody is going on a vacation this summer, evidently. You've already touched upon the topic of the necessity to implement telemedical services and to integrate them into the mandatory medical insurance system of Russia. And I believe that in the upcoming 2 years, and you said that in 2021, it should become the mandatory or accessible through our medical insurance. I mean, mandatory one that is accessible for everybody. But when it comes to voluntary medical insurance, here, well, I think that we are not lagging behind, we are not stagnating. Perhaps there are some packages and programs of the voluntary medical insurance that already include telemedicine. So not for us to wait for something to happen, but to move ahead. Well, digital healthcare train is moving indeed. When we talk about both the public sector and the private sector, we do see some progress made, but it was made not this year. As of today, almost all the programs of voluntary insurance across all the insurance enterprises include the coverage of telemedical consultations. And insurance companies do have partners. These partners provide their customers and their clients with telemedical services. Those who just live where they are registered, as well as those who travel. There are also some hybrid or mixed programs. Those programs within which, well, the customers of the insurance companies can select whether they would like to get an offline or online medical assistance. There are some more programs, but there are less of them. But within these programs, the customers can get some medical assistance only through online formats. Why? Why is it not so popular? Why? Because it's very difficult to diagnose a patient with something, and but still, in 40% of cases, the medical task is addressed, the medical task that is set by the patient, but this proportion could be increased up to 60 or 70%. And the online assistance saves not only the time of the patient, but it also saves the money of first the insurance company, because we also see that it will offload the companies and it will also decrease the price of an insurance. Well, the companies will spend less money and the insurance will be more accessible. Today, we see that the price of the voluntary medical insurance is not rising right now in Russia. And so it is indeed, the telemedicine is included into the voluntary system, and there are about 15 million people that can make use of that, and they do make use of that, some proportion of them at least. Secondly,
there are policies which envisage only working online, so online entry offline, but there are problems with the regulation regarding diagnostics. There are also specialized online programs, for example, programs secondary opinion, when the target policy. So people buy policies, they use, for example, obligatory medical insurance, OMS. This is online insurance program. It's called the program Second Opinion. They are offered by a lot of insurers. There are programs in the area of healthy lifestyle or nutritionist online or rehabilitation online, for example, post-COVID online rehabilitation. There are hundreds of thousands of customers in the country and several insurance companies which offer post-COVID rehabilitation online. There are more specialized only online, purely online insurance products which allow to stay online and to receive customers and to receive what customers need. So state program and other programs of private medicine, and also the program of life insurance. Thank you very much. We touched upon a very interesting subject. This is gathering of medical consultations, database, big data. So and also preventive predictive analysis towards people. But there is one more thing, and here we have Artur Isaev. Besides preventive positioning of what patients need to do when they need to apply to clinics, what analysis or research they should can go through. We also have not digital but genetic research. I would like to ask this question. So regarding this work or customer-oriented approach towards patient, what is the role of genetic research in health of our people? Is here demand for such services? And this is also important for people to understand how to proceed. Thank you very much for the question. And here I want to say, speaking about demand, now demand is only in narrow segments in these directions. And it's even not at the early stage of implementation in practice of healthcare. So implementation of healthcare, these are standard guidelines regarding Russia. Private healthcare, when customers, patients pay for themselves, in the budget of healthcare, it's only 10%, less than 10%. From the point of view of significance, this direction linked to the genetic research has great potential. Many people who are connected with this, they know it, that genetic research and data about genome of a tumor, for example, or some patients can give a different level of knowledge about disease. This genetic method, the same as microscopy or X-ray method, shifts the paradigm of understanding of the disease, its development. Now we are only at the beginning of this understanding. In some spheres, it can give very good efficiency from the point of view of diagnostics, treatment, and prevention of the disease. And this is noticeable. In such directions, integration goes very quickly when patients and doctors can see that this method can dramatically change the outcome of the therapy. For example, treatment of infertility with the help of echo, or so you can make not 2, 3, 4 cycles of echo, but for example 1.5. And even doctors want the results. This is time also, but time is money. EF. And the other method, which is also very efficient, this is diagnostics of tumors. And this is another level of diagnostics. For example, we have cancer of lung and then histological types. But now the diagnostics is done based on mutations, genetic changes, and this can give us a chance to choose the therapy, to develop target medications, and this gives added value of onco disease. But the problem is that all this genetic research and data have different volume of data, which is difficult to prepare for. If earlier schizophrenia was one disease, and if we spoke about disease, there are 60 different genes, 60 different approaches to therapy. Theoretically, the same with the target therapy of tumors. The volume of knowledge which we had earlier cannot be enough sometimes, and during 6 years of studying, to get knowledge about all directions is very difficult. That is why I want to say that IT solutions will be in demand, and also algorithms, because in this situation, the doctor cannot be creative. This is a certain process which can be carried away with a standard set of research, because they lack knowledge here. I would like to shift to another topic because we are running out of time, and discussion can take for a long time. Of course, it's quite an important topic. It's very interesting for all our viewers, but we have to finalize. I would like to ask the representative of private medicine. Badma Bashankayev, we welcome to greet you. He is the medical director, chief surgeon of GMS Hospital, Moscow, Russia. Can you name key technologies? We discussed a lot of them, but from your point of view, what are the main 2-3 technologies which will define the future development of medicine? Good day, dear colleagues. I will be brief. Artur, I agree with Artur. I'm for genetic research. I think a lot of problems with oncology will be solved with the implementation of these genetic tests and genetic research. It seems weird maybe, but education if education of doctors changes, it will be more it is more practical. Medscan does it already, and international clusters do it. So for Russia, it would be appropriate, really, more appropriate than different technologies like robototechnics or 5G experience. We used this at GMS hospitals. I think the most important thing is to change paradigm of medical education. In this case, the life would become easier and happier. We conduct a lot of conferences for doctors. There are a lot of gaps. And I can see a lot of issues So you mean, I mean here there are not enough professional personnel, professional doctors, 8, 9 teams who are ready to do, good medicine for 49 million. It's not enough. I go around Russia a lot and Kalmykia. I think education suffers. I hope it will change. But globally, of course, robototechnics is important, accelerated digital transfers, blockchain, big data, AI, all these beautiful words, yes, they are important. But the paradigm of education is even more important right now. Thank you very much. I feel that we already have very interesting announcements for our regulators, telemedical services in compulsory health insurance, working with IT programs, more humane view on patients, and getting him closer to physicians. And on top of that, education of doctors. It's also very relevant, interesting for us. And online education, as one of the versions can be also used. Dear colleagues, we are running out of time, and I congratulate you heartily for your opinions, for your approaches, for your interests, and we want our people to be healthy in our country and live happy lives. Thank you very much, viewers. Now we are on the moon platform. Have a nice day. Goodbye.